Welcome to another edition of Dan Frequently Asked Questions. In this edition, we're going to be discussing cancer and diving. Keep watching. We got a question from a physician's assistant working in an oncology center who had a patient who happens to be a recreational diver, and they had a discussion about fitness to dive in relation to the stomach cancer this person was suffering from and had received treatment for. The question obviously was, are they fit to continue diving? Now again, this is an enormous topic because there are a variety of cancers and each one has their own nuances in as far as that may relate to risk of sudden incapacitation and a variety of other things. But let's use this example. In the case of a gastric cancer, one wants to know, is there a chance of sudden incapacitation? In other words, the person's diving perhaps in a remote location and there's now sudden pain or even bleeding. Well, that would be a catastrophe. So if there's a risk of sudden incapacitation, then that is usually a contraindication to go diving. If the condition is still unstable and if there may even be some residual cancer, that also essentially requires some additional careful assessment whether or not it's appropriate for the person to go diving. And thirdly, if the person's received chemoradiation, some forms of chemotherapy like bleomycin may cause the lungs to become fibrosed when exposed to high partial pressures of oxygen, and so diving with elevated partial pressures of oxygen may cause a problem even after the person's stopped the chemotherapy. So that needs to be known. And secondly, chemoradiation therapy tends to affect a person's overall fitness. So we would want to know whether the person's able to run on a treadmill and exert at least 7 to 9 METs, which is 7 to 9 times your baseline metabolic energy expenditure. That's typically considered to be the lowest common denominator of fitness that would be appropriate for recreational diving. And even then, one would recommend diving in benign conditions and avoiding long swims, extended exposures, or other things that may cause a problem if a medical problem were to arise. Okay, so that's just giving you some of the basics. There are a lot of other potential questions. We've got other articles in Alert Diver that we can refer you to, and even YouTube clips. So please look at those. And if there are specific questions that we need to answer, feel free to ask them. And thank you very much for taking interest in your patient and asking these questions. And for the rest of you out there, until next time, safe diving.